So I'm Dr. Theresa Lee. I'm a medical oncologist that works at UPMC, specializing in breast cancer. So to me, the campaign name really focuses on understanding that each patient and each person comes to us with their own unique background, and so their journey through cancer care is going to be different than everybody else's. It's really our promise that wherever you are, we will meet you. Our job is to know the very best science, the very best research, what to recommend for optimal outcomes, but we also are always mindful of making sure we keep in mind somebody's values and goals, and that we meet you where you are. And we're really very successful at that. Yeah, so the cost of cancer care has really skyrocketed recently. Health insurance only covers so much, really, no matter what kind of health insurance you have. And so in my patients, I see them sometimes struggle with the cost of medications, even just the next diagnostic test. People have made really difficult decisions to not get the next appropriate testing because they can't afford it. I treat breast cancer, so some of my young women really haven't completed childbearing. They haven't sometimes even thought about having their children yet. And so cancer treatment can really affect their fertility, and they certainly would struggle with being able to preserve their fertility through their cancer treatment to hopefully have a family that they desire later. The economy is such that even just gas or transportation is really a struggle for a lot of people. So I've certainly seen that be an issue. Oh, and something that's really near and dear to my heart is something called scalp cooling, which is helping a person who's going through chemotherapy be able to keep their hair in many instances, but that is currently an out-of-pocket expense. It's not covered by many health insurances. So some people are making a decision whether or not to be able to use that technology based on cost, unfortunately. Yeah, so I think people should donate to this campaign because all of us are affected by cancer, right? If you're fortunate enough that it isn't you personally, we all know somebody, whether it's your parent or your friend or your neighbor. We all know somebody who has cancer. And so, donating to this campaign goes to people just like you and your family and your friends and your neighbors. It stays local. It helps your neighbors here in Central PA. And the money goes directly to helping people get through, this event of cancer and treatment. This mission of cancer care, it is expensive, it is difficult, it is trying, and being able to take the burden financially off of people is so important. And I see it in people's eyes when you can alleviate even just the financial part of it. It helps to make everything easier. So thank you so much.